now, Katie Weiss is in Fairhope. She's looking into the preparedness of Baldwin County hospitals for this virus.
And Katie joins us live from an emergency room at Thomas Hospital. Katie, what can you tell us here?
Well, Bob and Lenise, after this week's Ebola scare in Mobile County, we're looking into hospitals at Baldwin County to see how they're ready to prepare for a possible Ebola outbreak here in Baldwin. So now I'm actually joined here with a nurse at Thomas Hospital, Nurse Julie Rowell. Thank you so much for your time. So, Nurse, could you just tell us a little bit about how Thomas Hospital is preparing for any potential Ebola case here?
Well, at Thomas Hospital, our nurses are carefully trained to ask screening questions when patients enter the hospital. If upon answering those screening questions it's determined that the patient may have Ebola, then our plan is put into effect, and I feel that we have a good plan. The staff have been rehearsing that plan this week, particularly in the emergency room, because the important thing to do if you do identify someone who may be a potential patient with Ebola is to isolate that patient and immediately protect the other patients in the hospital as well as the staff that will be taking care of that patient.
All right, thank you. And now I understand that you actually have some equipment that you'd like to show us about how you would handle a possible Ebola patient who would come here to the hospital.
Yes,
can you show us?
This is Sandy Lowe. She is our clinical educator, and she's going to show you that equipment.
Okay, so tell us, this looks like quite the contraption here. What is this all about?
This is about safely transporting the patient from outside the building into a protected environment, a negative pressure patient treatment area. With this device, we can get the patient into that area without chance of contaminating anyone else in our hospital. It's a way to care for them during the transport because we have a way to reach into the bubble and care for the patient. We've been practicing this week with our PPE, our personal protective equipment, and this is an example of what we will wear to care for these patients. We have a supply cart with everything that we need. We have a step-by-step process. So it's a way to keep ourselves safe, to keep the patients within our hospital safe, and a way to care for the patient themselves.
Okay, and could you just talk to us about the reason why this suit is completely covered the way that it is, very airtight sealed?
The suit, number one, is impermeable to fluids, such that if we're exposed to any body fluids from the patient, it will not get to the healthcare worker. Additionally, if there's any aerosolized particles, then we wear an N95 mask such that we can't breathe those in.
Okay. All right, thank you very much. We also just wanted to ask you, Nurse Julie Rowell, could you just tell us, as a nurse, how would you feel having to deal with an Ebola patient personally?
You know, as a nurse, I think there's always concern for yourself and for, if you were exposed, for your family. But with the plan that we have in place, our staff should feel safe. And that is the purpose of our plan, is to make sure that our staff is safe. So that is one reason we rehearse, and by rehearsing as a nurse, I feel safer myself.
Great. Thank you very much. We really appreciate it. We appreciate all the time here at Thomas Hospital. We'll be out here again on Fox 10 News at 5:30 with more information, so be sure to stay tuned. Reporting live for Fox 10 News in Fairhope, I'm Katie Weiss.